Okay, this is going to be my newborn assessment video. This is my lovely baby D'Angelo. We're going to start by measuring his length. He is a little grouchy, so you have to excuse him. So we're going to measure his length. And then we're going to measure his head circumference. Let me get over here. Okay, and then we're gonna weigh him, and he currently weighs 12 pounds. We're also going to measure his abdominal circumference. Okay, so the next thing is on newborns, there's 3 major vital signs that you want to take. It's going to be the temperature, and then it's going to be respirations and heart rate. So I'll just go ahead and take a quick listen to him. Okay, and then for the heart rate, you want to listen to the heart rate for a full minute. And then for the eyes, you're just going to want to look into the eyes and just check. Okay, now we're going to want to check for general appearance, the baby's color, the Mongolian spot right above their little butt. Also want to note their cry, the tone, and the APGAR score. Okay, we're going to also want to look inside the mouth. Just check the little mouth and check the little nose. And then we're going to want to check the shape of the head and the soft spot on the top. We're going to want to make sure the ears are in line with the eyes. Count the fingers and toes. Make sure there's 5 on each side, which there is. And then we're gonna also wanna check, when we're checking the respirations, we're gonna wanna check the effort, the symmetry of the chest, the rate of the heart, the rhythm, make sure that's all normal, and listen for any murmurs. Okay, and then for the abdominal checking, you're just gonna wanna see the shape, palpate, listen to the bell sounds. The umbilical cord should have those 3 vessels. Check the stool. A lot of times in newborn, it's that real black tarry stool. And also for the genitalia part, you want to make sure that if the baby boy is circumcised, you're checking for any infections, redness, making sure it's all nice and clean. If he is not circumcised, you want to be sure to educate the parents on keeping that area clean, pulling back that foreskin, and making sure that's clear of infections. Also check the rectum and make sure the baby's voiding regularly. Also for the spine, you want to check the spine, the hip placement, make sure nothing feels out of place. You want to also know if there's a dimple or a patch of hair over here on the spine that is not normal, and you would want to notify the provider right away. As for the reflexes, the Moro reflex is just that startling of the baby. On the toes, you can put your finger there and see if he grasps, which he is over here as well. Babinski's when his toes are going to flare out by touching the bottom. And then the hands also, he will have a tight grip. And the last reflex is going to be the rooting one. So if you go ahead and stick your finger in the mouth, they'll go ahead and do the suckling motion. Also, if you rub the side of their cheek, they should turn their head as to a feeding.